and presentation. So first question, that we all know that pregnancy is one condition where we can say they are pregnant ladies are clinical trial orphan. So here is one question: will there be any impact on pregnant women due to any COVID drugs? So what anti-COVID drugs we can use safely? Uh, what is your opinion, sir?
So you cannot just say absolute safety. When you talk of treatment of pregnancy, when it is complicated with serious condition, different serious condition, you have to think of the relative risk-benefit ratio. And when you talk of relative risk-benefit ratio, it is the, again you have to do prioritize that it is the maternal well-being that is given priority over the fetal well-being. Of that doesn't mean that we should not think of securing the fetus, developing fetus, but to the extent possible, if possible, we have to retain the pregnancy. But then, if we have to sacrifice, we will be sacrificing the pregnancy, but we will try to save the mother. So that is the general approach. Now, the different drugs, whatever we have discussed, again, some of the new drugs we do not have enough experience about their safety in COVID in pregnancy, whether it is remdesivir or whether it is tocilizumab, etc. But then, so far as the older drugs are concerned, like steroids, yes, steroids can be used in pregnant women who is suffering from COVID. But then again, when you think of the low molecular weight heparin, yes, we can use low molecular weight heparin. Regarding ivermectin, there is another question about ivermectin. I think ivermectin it is better not to use in pregnancy. Uh, but otherwise, so far as use of drugs in COVID is concerned, so far as mild COVID is concerned, it is better to limit the use of uh, drugs which do not have a very clear efficacy or evidence based, not to use it in pregnancy. But if there is milder infection, it should be properly monitored and regularly put under surveillance. And only when there is a tendency for the different parameters or the markers they are otherwise available, then only you can think of starting with corticosteroid, that is dexamethasone, or you can think of starting with low molecular weight heparin. Okay, but otherwise I would not recommend in favor of hydroxychloroquine or for that matter the ivermectin, etc. Neither is doxycycline, okay, for that matter.
Okay, thank you, sir. There is some studies are ongoing in USA on remdesivir in pregnant women, and
Right.
there are some case series also on remdesivir, and they are found to be safe. But again, we have to be cautious regarding its
Right.
use in pregnancy.